Hey guys, so I'm here with my longtime friend Geraldine and like FODMAP expert, I guess we could call her, or gut health
Sure.
dietitian. Jez, I call her Jez. I'm probably the only person that still does that. Is that right?
Yeah.
Yeah,
My real name, my adult name's Geraldine now. Thank you very much, Joe. Not 12 years ago anymore.
yeah. So yeah, I used to study with Jez. Can you tell us like what's your intro or like what's your fancy title?
So I'm known as the gut friendly dietitian. So basically, I own a private practice in New South Wales in Australia,
Hmm.
and I focus primarily on food intolerance, particularly for people who have gut issues and medically diagnosed IBS, and we use a low FODMAP approach quite often there.
Okay. Are you gonna tell people you were like the first Monash, what is it? Accredited dietitian? What's that called?
Oh yeah, so um, the low FODMAP diet hasn't really been around for all that long. Maybe somewhere between 10 and 15 years. It was discovered by Monash University, which is in Melbourne in Australia.
Hmm.
And it was only in 2017 that they released their first training for the low FODMAP diet. And I jumped on board straight away. I got in there and I was the very first dietitian globally to finish their course, and was the first Monash University trained IBS and FODMAP dietitian. So I guess that's the title there. Yeah, it's a bit exciting.
AKA, so you know your stuff. You know your shit. Pun
I'll
intended.
try to. Yeah.
Okay, so let's jump into questions straight away. So from my clients,
Yep.
um, how to build up a tolerance to food if possible. When you know that you are sensitive to a food, what's the best way to deal with? Right, well, I guess that's a separate question. How to build up a tolerance to a food? Is that even possible?
I think for some particular things it can be possible. So when we think about chili, for example, if you have a small amount and over time you sort of get used to it, you can build up a tolerance that way. But that's in terms of taste. In terms of intolerance, the only way to build up your tolerance is by probably by reducing all the other external factors um, that build into that affect your threshold level in the first place. So if you're not familiar with what a threshold level is, it's basically the level in which you can tolerate a particular thing before you start to get symptoms. So for example, if you're really intolerant to lactose, for example, one of the FODMAPs, if you've got gut issues from that, if you, for example, have a lot of stress in your life, then your tolerance to lactose is going to be a lot less than if your stress was managed more appropriately. But in terms of actually improving your tolerance levels, I don't think there's another way. It's just improving the other factors sort of around it. Yeah.
Hmm. If we flip that question, will
Yep.
avoiding foods create further intolerance?
I don't think there's any literature on it at the moment. Some people report what we refer to as hypersensitivity, where you've been avoiding FODMAPs for quite a while, and then you reintroduce FODMAPs, and then you react, you know, quite a lot, quite quickly.
Hmm.
But we don't really know if that is because you've, now got settled symptoms and you're sort of more used to that, or whether in fact you are actually hypersensitive. Now we don't really know. Yeah.
Okay, because my thinking was like, well, I know that Monash had said like if you follow the elimination phase of a low FODMAP diet for years and years,
Mm-hmm.
that's not ideal because say if you've got an intolerance to fructans and you're avoiding them all, then
Mm-hmm.
that sensitivity becomes worse. At least that's what I thought. Are they still saying that with regards to like long-term elimination diets?
Yeah, so that they're still saying that you shouldn't be on the low FODMAP diet, the strict elimination diet, which is the first phase, for an extended period of time. So generally speaking, you should only be on that phase for 2 to 6 weeks before you want to start to re-challenge foods if you've gotten really good symptom relief. And I guess there's a few reasons for that. And it's more so around because it's quite restrictive if you're staying on the elimination phase. So that restriction will limit not only your food variety, but then your nutrition intake. And also because FODMAPs are, a lot of the FODMAPs, not all of them, but a lot of the FODMAPs are what's called prebiotics. So essentially what these are is food for the gut bacteria that live in your large intestine. And they have a crucial role in keeping us healthy. So if you're avoiding these FODMAPs for an extended period of time, then that can really play up with your gut health. And of course, some people will be reacting to these FODMAPs. So they're the ones that you want to be keeping out of the diet. But there are going to be, it's very likely that there are going to be some FODMAPs that you can tolerate quite well, so that you can actually bring them back into the diet and nourish your gut bacteria that way.
So FODMAPs are good for us?
Yeah, they absolutely are, to an extent. Yeah, so they're really good for gut health, but unfortunately for people with gut issues, they can cause those really awful symptoms. So it's finding that balance.
Yeah. Okay. Yeah, but that's the whole. That's nutrition in a nutshell. Finding the balance for you.
Yep.
Yeah, and I guess just to clarify, like, because people get mixed up, probiotics and prebiotics. So probiotics are the actual strains of bacteria that are thought to be beneficial, the good bacteria. Prebiotics is what those bacteria feed on or eat, metabolize to grow or to flourish. Because the probiotic is a bacteria, it is a living thing. It has to eat, essentially. That's what the prebiotics are. That's actually that's actually what's going on, right? If you've got a reaction to a FODMAP, the bacteria is fermenting that FODMAP, and then the byproducts are gas or potential issues as well, which we can get into. But I just wanted to clarify that one.
Yeah.
Okay.
Exactly.
I probably should have asked this at the start. Low FODMAP diet. Is it only for people with IBS? What about IBD, like some types of, ulcerative colitis, Crohn's disease? What about diverticulitis? What about, I don't know, is there anything else? Or is it, what are you using it with?
So the low FODMAP diet was initially to be used for people who have IBS, but the symptoms of IBS overlap with a lot of other conditions. So for example, IBD would be one of them. So for people who have well-controlled IBD but have ongoing gut symptoms, can use a low FODMAP diet to get their gut symptoms under control. Likewise with people, for example, who have celiac disease, if they're following a strict gluten-free diet and they've got ongoing gut symptoms, then they can use a low FODMAP diet. Endometriosis, SIBO, which is small intestinal bacterial overgrowth, is another common one as well that we're starting to see a little bit more of.
True. I forgot to mention endometriosis. Okay. Yeah. So it's more like, it's not that it directly helps the physiology of those conditions. It's more like people with those have probably got IBS as well to some extent.
Yeah. So it's more about managing symptoms.
Yeah. Okay.
Not a cure.
Cool.
Yeah.
No. All right, next question. When you know you're sensitive to a food, the best way to deal with the reaction if consumed, for example, best way to treat bloating. Does that make sense?
Can you reword that? No.
What's the best, if you're sensitive to something, what's the best way to deal with the reaction? Like say it's like, oh yeah, onions is the worst for me, it makes me bloated, and then I eat a buttload of onions. What do I do?
Okay, so probably one of the biggest things that is going to work for you, unfortunately, is going to be time. But there are a few things in the meantime that may be helpful if you're getting what we call a flare-up, or FODMAP flare, some people use that term. FODMAP bite is another colloquial name for it. But anyway, so some people find peppermint tea quite useful, or peppermint oil can be quite useful as well. So there are some supplements that people use, heat packs, some gentle exercise, some rest, some yoga. It's dependent on the particular person in how you're reacting. And then you can also use some over-the-counter medications as well, so antispasmodics that might help if you're getting some stomach pains and spasms there as well. So, but all in all, once the FODMAPs actually are fermented by the bacteria and everything starts to pass through the digestive tract, then basically it's time, and then you'll get back to that that better symptom control.
Mm-hmm. Cool. What about constipation? Because I see a lot of people, right? IBS is typically people are going to associate it with, well, mixed symptoms or diarrhea, which we call IBS-D. But then there's IBS-C, which is definitely like, if we go by the studies they've done, we know that low FODMAP diet is significantly helpful with certain symptoms, bloating, IBS-D. C, constipation seems to be a little bit trickier. Do we know why? Do you use the low FODMAP diet with IBS-C? Do you use anything else with it? Like, what's the go there?
Yeah, so IBS-C is definitely the more challenging IBS subtype to manage. So the low FODMAP diet's really good at reducing bloating because you're reducing the gas production, because you're removing the FODMAPs that are fermented by the gut bacteria, and so there's no sort of gas and bubble production, which can lead to bloating. And the other thing that it's really good at reducing is stomach pain, and that's because in people who have IBS have really sensitive guts, which is called visceral hypersensitivity. And so it's really good for those two particular things. It also is quite good with diarrhea. But on the flip side, with constipation, we still can use a low FODMAP diet, but quite often I would need to use some additional strategies to help in managing those types of symptoms. So some of the ones that come to mind would be, firstly and foremost, making sure that you're eating enough fiber, so gut-friendly fiber. A lot of fiber can, in fact, flare up symptoms in people who have sensitive guts. So it's looking at low FODMAP fiber options for fruits and vegetables and whole grains, for example, but also making sure that you're getting enough fluids in the day. If you're not getting enough fiber through food, sometimes there are some supplements that people use, like psyllium husk or partially hydrolyzed guar gum is another kind of new one that I've been using with a lot of success. It helps with both diarrhea and constipation, but I use it a lot with constipation. There are some probiotics as well that potentially could be useful with people who have constipation as well. And then if you're looking at it holistically, so we're looking at things like gentle exercise as well, and managing stress, because when you've got a lot of stress and anxiety in your day-to-day, that's going to switch off the gut and it slows it down in these people who have a slower gut motility, or the speed in which food moves through their gut.
Mm-hmm. Partially hydrolyzed guar gum. How do you buy that? Does that exist as itself in the shop?
Yes, it does. So in Australia, there is so I'm not sure if it's sold as well in the US, but I do know that this brand is sold in the US, so it may be. So it's the one that I quite often use is Pro Nourish.
It's Nestle, is it?
Yeah, yep, exactly. So it's a newish product. I'm not sure how long it's been out for, maybe 1.5, 2 years, something like that, off the top of my head. And it's a soluble fiber, so you can add it to anything liquid like your morning coffee, or maybe, actually, that's a good tip for constipation. Some things like caffeine can actually help to get you going. And if it does, then you can use that as a way to help manage your symptoms. Mm-hmm. There we go. But the PHGG, or the partially hydrolyzed guar gum, doesn't actually taste like anything, and it fully dissolves in the liquid that you're drinking, and it doesn't thicken up like psyllium husk does. So it's sort of my go-to over psyllium husk, but fiber can be a little bit individual for that particular person.
Okay, I want to stick on this topic for a little bit. So, okay. Yep. What about low fiber diets? Yeah. Do you feel like some people respond better when they have little fiber, which goes against everything that everyone's taught?
Yeah. So when we look at what people are actually eating, most of the time I do see people aren't having enough fiber. So a lot of the time it comes down to, firstly, most of us don't eat enough fruit and vegetables. And then when we're switching over to a lot of gluten-free products, which is not a FODMAP, but the FODMAP and the gluten coexist in the same products, like wheat, for example, the fiber tends to be reduced in these gluten-free products a lot of the time. So quite often the recommendation is to increase your gut-friendly fiber. But in some instances, some people can really overdo it. They might have too much fiber in their diet because they're trying really hard, or increasing their fiber too quickly. And so sometimes reducing it back down can actually be more beneficial for these types of people, which seems a bit ironic, but yeah, it can really, really be helpful.
Like, do you have a number goal that you're reducing their fiber to, or are you just kind of looking at their diet and like picking things out? Like, how do you do it?
Yeah. So I don't have a particular number. It's more of me eyeballing what they're eating. So, for example, I had someone who was having flaxseed, chia seeds, psyllium husk, and breakfast cereal all at the one time in breakfast. And that is a huge fiber overload. And particularly if that person is going to be increasing from a really low fiber cereal to all of that in the one go, and they're not having enough water, and not, they're quite sedentary, that can really, do the opposite effect and block them up rather than get them to go more regularly.
Mm-hmm.
Yeah.
Okay. How soon to see improvements if you do like guar gum and it's successful with someone?
It's different for everybody, I think. I usually get people to do a fiber trial for 2 weeks to see if there's any improvement, and if not, we'll move on to another strategy, whether that be a different one completely, or to add on another strategy to see if 2 strategies rather than one works.
Mm-hmm.
Another thing that can actually be quite useful for constipation that has come to mind is actually reintroducing FODMAPs. And that sounds a little bit strange, but there are some FODMAPs that have what's called an osmotic effect, so it draws water into the bowel. So it's actually quite common for people who have IBS-C to go on a low FODMAP diet and their constipation goes worse. And that's because we are also removing those osmotic FODMAPs. So fructose, for example, which is found in fruits, a lot of fruits, and polyols, again, found in a lot of fruits. So, things like prunes and pears and the stone type of fruits as well, and can really dry people up. So by re-challenging with these FODMAP groups to see if it can actually help to make them more regular without increasing their stomach pain and bloating, or finding that balance, is another strategy that can work quite well for people with constipation.
Okay. What about some foods that you find that increases constipation? Like, because I got some clients and at least 2 of them swear that if they eat bananas, like it slows things down more. And it makes sense if you think about like the brat diet, which is like the one after, I don't know, so you get sick with something and it's like you can eat bananas, rice, apples or something. Yeah, like if you got really bad diarrhea and stuff, you follow the brat diet, and bananas is one of those. So, but then bananas are like super high fructose. Is that so? Like
fructans? They're fructans.
Fructans. So it's like that's the one. So it's like, well, I don't know. Have you had experience with that with your clients, like bananas slowing things down, or?
Look, I haven't, not with bananas. And I also just find it quite strange with the brat diet because apples are in there. And yeah, for some people who have IBS, maybe it can slow things down for them. But apples are one of those FODMAPs that actually contains the osmotic FODMAPs, which, can potentially help to improve their constipation. But, I don't have any particular cases that come to mind straight away where particular foods block them up. It's more of a whole diet where it's just not working for them. And I find that sometimes if a low FODMAP diet isn't working for them and they're still blocked up. I've actually had success with putting them on a different type of elimination diet, which is potentially a lot lower in fiber actually than a low FODMAP diet, and it's been working quite well.
Okay, is that like a Geraldine special diet or something?
No. So it's actually a diet that the Royal Prince Alfred Hospital up in Sydney, they founded the diet, I think 30 odd years ago, and so it's a low food chemical diet. It's also known as the RPAH elimination diet or fail-safe diet.
Yep.
But so for 3 out of 4 people who use a low FODMAP diet, there's 1 in 4 that don't respond. And so sometimes if you assess a client and they may present with some other symptoms, like maybe some skin rashes or they get headaches, and the low FODMAP diet is just not working, they've got gut symptoms, then sometimes trialing them on a different type of elimination diet can actually help there as well.
Mm-hmm. And this is going into like food chemicals, histamines and amines and stuff.
Yeah, so the RPAH elimination diet reduces all of the amines, so histamine is just one of them.
Yeah.
But I guess similar.
Okay.
Yeah.
Cool. Okay. Time for one more, I'd say. Can you get tested for food sensitivities? I know you can. Maybe the question is, should you? Like, are they accurate or are they just total BS? What?
So, using your words, really sorry to anyone who has spent literally hundreds of dollars on these sorts of tests. They are BS. A really common one is a blood test for Igg antibodies. And this, unfortunately, it's a blood test that actually, your Igg antibodies will be raised when you actually consume these foods quite a bit. And quite often people who get these types of food sensitivity tests will have a whole range of foods that they are apparently intolerant to because their Igg has been raised, but it's just because they've been exposed to these foods. It's absolutely not true to say that they're sensitive to all of these foods, although coincidentally it could be that they're sensitive to some of these foods because they might coincide with their FODMAP intolerance that they didn't know that they had yet, for example.
Yeah.
So there's lots of tests that you can do for food sensitivities, but the only true way to determine whether or not you have a food sensitivity, unfortunately, is to go through the process of elimination, reducing everything down till you get really good symptom control, and then reintroducing one substance at a time to see if you react. So you're replicating those symptoms that you were having on a day-to-day or weekly basis previously.
Mm-hmm. Mm-hmm. Yeah, I've had clients who have done those tests, and then they're like, "Oh, I'll dig up the sheet," and they've done it like 5 years ago or whatever, and then they send it, and it's just like all this random, like loads of foods that are super random and completely unrelated, and it's like, so I don't eat those, and I'm like, well, you don't eat all of these foods, like. And like, or they'd be like, yeah, well, I didn't initially, and then I started eating them because they're like part of a normal diet and people eat those foods.
And how did they go? Did their symptoms return or were they all right?
Well, they're working with me, so they're not good.
Oh, fair enough.
Yeah, so like it'll be just a list of super specific things, like a type of nut that you never heard of, and like
right, okay.
shellfish will always be there, I guess. Egg, dairy, like just huge food groups, but then also like super random things like subtypes of beans and and I just don't think, well, I know that you can't really pinpoint like down to that specific type of variant of vegetable, but it seems like despite, I guess when people are kind of, they're unwell and they're desperate, they're looking for answers, and this kind of provides a black and white on paper answer,
Yeah.
yes, we've tested your blood and this is what it says. But from everyone you speak to, and like every health professional I speak to who ask the same question, they're like, what? You know, when I work with clients, nothing matches up to what their blood test,
Yeah.
food sensitivity thing says. So I
Yeah.
was
Yeah.
curious.
Yeah. Yeah. It's really awful when people yeah, get these things tested and they're just not true.
Um, can sensitivities change over time?
Oh yes,
Um, Talk to me a little bit
they can.
about that.
All right. So sensitivities do change depending on a lot of different factors. So some of the more common ones would be hormones. So if you, for example, if you're a woman and you're getting to the time of the month, or perhaps you're pregnant, your sensitivities can worsen or become better. So usually they worsen around the time of your period, and then for people who are pregnant, it's like their gut symptoms have disappeared and they can tolerate quite a bit, which is really good because, you know, if you do have food intolerance, then your diet is restricted in some way. The other thing is sickness, illness. So if you're ill, your sensitivities will be worsened, and some medications and supplements may alter your sensitivity levels to things as well.
Mm-hmm. So it's like, I swear when some people, like when they're pregnant, they like become superhuman and they're like just immune to stuff. What's the go there? Just a hormone? Is a hormone shift, or like is this like we're talking like a gut brain axis, like the vagus nerve is less sensitive or something? Like, do we know
Yeah.
what's going on?
No, we don't, but we do think that there's some kind of hormonal um, thing going on there because, so for people who have IBS, 1 in 2 are women. So there's definitely that hormonal component, but we don't actually know specifically what changes. But so many reports of improvements in sensitivities when they're pregnant,
Mm-hmm.
but we don't know how, why. We don't know why yet. Yeah,
Mm.
as
So
far as I'm
just
aware.
so just keep getting pregnant. You'll be good.
Uh, yes, that's an option.
Maybe back in the day. And then definitely, so time of month when you've got your period, like
Yeah.
it's worse, and that's very consistent with people, isn't it?
Quite often, yeah, that's what we see. Yeah.
Mm. Okay. One other thing came to mind, like, so what about stress? So obviously,
Mm,
when we think about digestive issues and food
yeah.
intolerance, it's like, okay, well, it's the food you eat, right? What goes in your mouth and what
Yeah.
comes out. So we know that's not not the only thing contributing, and IBS and a lot of digestive issues are multifactorial, I guess. So like stress is the other big one, would you say? And how
Stress is
like
huge.
stress is even bigger than the foods, or what?
Yeah, for some people, it can be a lot bigger than foods. And, you know, it's one of those things that can alter your sensitivity or your threshold or your tolerance to being able to include or not include, for example, FODMAPs in your diet.
Mm.
So for someone who is quite stressed, they might find if they're also on a low FODMAP diet and they start to try and re-challenge or reintroduce some foods, they might find that they're actually reacting to everything. And they think, oh my gosh, I must be so sensitive to foods, when in fact it's actually their gut-brain axis or their gut-brain connection, which is the connection between what's going on in your gut and your brain. It's sort of the thing that gives you butterflies when you're nervous. That
Yeah.
can really,
So
yeah,
that's a good example. Like
yeah, yeah.
through public speaking, or when you're young doing a race, it's like you're feeling anxious, but you
Mm-hmm.
literally feel it in your stomach, and
and
that's
and that's and that's also why I do nervous wheeze and poos.
yeah. Okay, so that's
Gut
literally
brain
that's the
axis.
gut brain axis,
Yeah,
which is actually the vagus nerve.
yeah,
Yeah.
yeah, exactly. But yeah, so stress can be a really, really big part in gut symptoms. So, for example, actually, my husband is quite intolerant to onion and garlic,
Mm.
but when he has his stress under control, he can include onion and garlic in small amounts without an issue. And if his stress is not under control, he will be running to the toilet multiple
Mm.
times a day.
And how does when's stress under control and when is it not? Like, is that by chance or is that by design?
So it's something that he has to work on. Yeah. So it's intentional to put some strategies into place to work on stress, if that makes sense. Is that
Yeah,
what you mean?
okay. Yeah,
Yeah.
yeah, yeah. Well, I was thinking like, yeah, okay, so it wasn't just like by chance. Oh, I feel chill today, I'm relaxed, like I can
No.
eat onions. It's more like a work in progress.
Yeah,
Just chewing an
absolutely.
onion. No, so yeah, okay. And when we say stress, like it's not like fluffy, like we're talking about this, loose terms that can't be measured. Like stress can be measured in terms of like cortisol in your blood. Like, so
Yep.
it's like it's like we know it directly affects like our hormones and our health. So you've got to take
Mm-hmm.
measures to reduce stress in your life, and that's easier said than done. Like, yeah, you've got young kids, you've got family issues at home, or you've got issues at work, or whatever's going on, but you've got to if that can't change, well, you've got to at least do the things that are within your power to help manage the stress. So what are some of the things? Something that comes to mind is like mindfulness meditation, which is I guess an evidence-based way to lower stress.
Yep.
Yeah, it means you've got to take 10 minutes out of your day, or find or make, I should say, 10 minutes in your day somewhere to practice that, right?
Yep.
And I tell people like Headspace is a good way to learn that.
Oh,
Like
I
the
love
app, you get a free 10 days to trial, right? Just to see like, okay, what is this stuff? And his voice is like
it.
amazing. He's a dreamy guy with his English accent. It's really calming. But then it's like, and then I think it's really cheap, obviously a couple of dollars per month or something. But do you have any other tips? Anything else come to mind?
Yoga. There's also meditation that ties into yoga, but there are some papers out there on how effective yoga practice can be in managing gut symptoms.
Mm.
Just as effective as a low FODMAP diet, actually, which shows you just how important it is to be managing your mental and emotional health. Exercise, I guess it's a similar thing because you're managing your stress, you're releasing endorphins and that sort of thing can
Mm.
also be helpful for your stress. Cognitive behavioral therapy, which is a psychological intervention where you see a counselor and they help you with your thought patterns. And then another thing that sounds quite hippie is gut-directed hypnotherapy. So I'm not sure if there's gut-directed hypnotherapy around the world, but there is a place in Melbourne and a place up in Sydney, which is they're a little bit far from where I am. But anyway,
Mm.
so the evidence does show that using that approach can be just as effective as a low FODMAP diet as well.
Yeah.
So I guess when we're looking at these gut symptoms, then diet is only one factor in managing, and we need to look at this holistically. There's so many different ways that we can manage gut symptoms, not just diet alone.
Mm-hmm. Yeah, and that comes full circle to all nutrition recommendations and health issues. Like if I'm speaking with people with like autoimmune issues, or if weight loss is a goal, or if it's food intolerance,
Yep.
Don't pick just one piece of the puzzle. Like even with food intolerance, we're just looking at the food,
Yep.
and yeah, it's not the complete picture. It's not the full puzzle. If you're missing pieces, the chances are you're going to struggle, or you're not going to get the full result that you could if you were looking at the other factors as well. But yeah, I wanted to touch on the stress stuff because yeah, it's huge. For me, like a quick thing you guys can like try to observe. For me, it's like your usual daily pattern is
Mm-hmm.
the kind of ongoing stress. And of course, you can't really get out of that necessarily. Yeah, you can better manage and learn more about reducing your stress levels. But like when I go on holiday or vacation, then the environment's completely different. Yeah, the
Mm-hmm.
food you eat's different, but it's just like you're out of that day-to-day routine. And I'll find then that my symptoms are gone basically. Or like, do you had clients say that, or is that the same for
Yeah.
you?
Yeah, that's a really interesting thing that you mentioned, because it just reminds me of a lot of people who I speak to. When they do go away, they find that they can eat freely almost, or in many cases. And that, again, is to do with their lack of stress when they're away on holidays. And that means that their personal threshold level, or how much they can tolerate before they get symptoms, is very much increased. And so they can enjoy those sorts of things.
Yeah. And
yeah.
Yeah, I think it is like the actual vagus nerve is like less, it's constantly slightly stimulated in your normal stressful routine and environment. And when you change it, it does actually chill. And so your threshold increases for certain foods, and likewise the sensitivity is coming down. That means, but that's just something I thought about, because whenever I speak to someone, I ask them, like, one of the things I say is like, what about when you're away? Do you still experience it? Because people don't think about it, and they're like, oh, actually, not really. It's like, well, then stress is a big factor, obviously, but it's just a way for you to see that yourself. And then, so that's kind of, that's a piece of the puzzle you need to look into.
Yeah. And what I find as well is that people find the actual travel part really stressful, and it flares up their symptoms. But once they're actually at their destination and out of
cocktails.
their usual environment, they're all good. Yep.
Okay, one other thing I thought of just then was SIBO, small intestinal bacterial overgrowth. Obviously, we know that low FODMAP diet can be part of the approach for that. However, you've essentially got an overgrowth of bacteria in the small intestine, whereas a low FODMAP diet is typically targeting reactions in the large intestine or colon, which is after the small intestine. So if you do have bacterial overgrowth in there, it typically needs to be treated with an antibiotic, right, to remove the bacteria, both bad and good, I guess. Now, usually it's a pharmaceutical, like prescription medication, rifaximin or something like that.
Yeah.
Is there natural alternatives to the antibiotics?
Yeah. So there are also antimicrobials that you can use to treat SIBO. So sometimes if a person does not respond very well to treatment via antibiotics, then they can try antimicrobials. And I guess the other approach is if you are someone who likes to do things the natural way, then you can go down the antimicrobial line as well to treat your SIBO and eradicate the extra bacteria that's there, and then use a low FODMAP approach to starve them out as well, and treat it that way.
Any examples of what they are?
I don't actually, hang on, what the names are of the antimicrobials?
Yeah, or like is it like some essential oil, or like a supplement, or like what are we talking about?
They're herbs, as far as I'm aware. So they're not something that I would prescribe. It would be more of a naturopathic doctor or an integrative doctor, or a naturopath that would be prescribing these things. As far as I'm aware, they're herbs, so they're from plants, and I don't know the mode of action in which they would treat it, but it seems to be quite effective. And I don't know how much there is in the literature for using antimicrobials over the antibiotics as well. I'm not sure if you might know.
I think they're just an alternative.
Yeah.
Like I believe it's an alternative that can work, like 100%.
Yeah,
but
so do I.
I would go with, obviously, I'll try to go with the pharmaceutical first. There's just some people who just don't want to do that. So that is the option for them. And essentially it goes, you have the antibiotics first and you're eating normally, so as to have those problem bacteria quite active, so the antibiotics can attack them, essentially, because otherwise they go dormant, and if they go dormant, there's a chance antibiotics doesn't work. So we need to be eating normally, right? After you finish the round or 2 rounds of antibiotics or antimicrobials, then you can pursue the diet changes, the low FODMAP diet.
Yep, exactly.
Cool. Okay, nice. All right, that's all I had.
Bye again.
Bye.
Thanks.